This is Brandon, Dr. Brandon.
Hello, hello.
He says he's been having, is it left or right where you've been having most of the...
Left shoulder pain. Really when I'm bench pressing, overhead pressing. Feels just tight and stiff. Like I don't have the motion and mobility in my shoulder.
So one of the first things that I probably would have looked at, except for the fact that he's already laying down, is I would have checked his pec tightness. A lot of times when people complain of shoulder pain, it's because they're in a really forward position, which a lot of times is caused from pec tightness. He said it bothers him doing bench press, overhead stuff. So that's one of the first things that I would have checked, but he's already here, so we're just going to leave him here. So I'm going to needle a couple different things. First of all, I'm going to clean off my gloves, clean him off with some alcohol. Brandon is a good example of what we call sympathetic responses from the body. When he gets needled, it's not that it like really bothers him, but his body doesn't so much like it, and he'll start sweating. So one of the first things I'm going to needle is called the infraspinatus. It's one of the muscles that contributes to the rotator cuff. Can you tender along in here?
I'll go like on the shoulder blade, usually where it gives me like, oh, there you go.
I find it?
Oh, yeah.
Alright, go ahead and relax. I tell you, let your arm just kind of hang on. There we go. Okay, alright. I just like to find where the shoulder blade is, so I'll get on here and I'll grab it at the bottom. Good.
There you go.
Yeah, see? We created a twitch without even using the needle. You want me to stem it?
Oh yeah, if you can.
Alright, so, tender, yep.
Yeah.
Relax that trap down. So I'm going to bring my fingers in here, I'm going to bracket that area. I know his shoulder blade is right behind it. How's that?
Good.
Okay, so I'm going to leave that right there. Bracket up this area again, here. Brandon said he had a really muscular back, and so he wanted the really long needles, and this is what ends up happening. He said we're gonna have a lot of tissue to go through.
Well, if they make the needles long enough, that.
Right. Sometimes just giving the needles a little spin helps get them started. How's that feel?
Good. Tell you getting something.
Yeah, that's good. That's a good thing.
It's in a good spot.
I'm going to hook him up to some E-stem. We'll steal Brandon's little analogy here. Let's see if it'll hold down low there. It's like a regular E-stem unit on steroids. You can just get a lot more specific. You can get into particular muscles. So you just let me know when you start to feel it.
Nothing gas.
Feeling it a little bit?
There you go, a little bit.
Hey, there we go. We're starting to see it. I'm going to keep going up.
Yep, you keep on going. Keep going.
This is great because you can really see the infraspinatus. You can see like the whole entire actual outline of the muscle. I'm going to pat myself on the back for that one. Feeling pretty good?
Yep, you can feel my arm going out too.
Yep. Yeah, so Maggie, so you can see here how when the muscle twitches, his hand wants to come up a little bit. And if you think about it, of course, like I said, this is part of the rotator cuff, so external rotation, that's one of the actions of the infraspinatus. So when it contracts, you externally rotate. So as he's laying there and his arm is wanting to come out, it's wanting to externally rotate. So, like I said, that's how we know we got the right muscle. I'm going to turn the intensity or the frequency up. We're going to go a little bit faster. We'll put the intensity down just a little bit. How's that feel?
That was amazing. It was like I needed it.
How does this feel?
Um,
Interesting?
yeah, it feels, I had to describe it. I don't know, it's hard to describe.
Almost like a cramp, but not a painful cramp?
Right, like a mini cramp though, not a very intense cramp.
We'll turn the intensity back up just a little bit.
But it feels like it's someone's just tapping you on your shoulder.
All right, we're gonna let that roll, and there you have it. That is dry needling and stem of the infraspinatus, the rotator cuff.